Hi, this is Dr. Jayini P. Raman, orthopedic surgeon, heading PACE Hospitals, Department of Orthopedics. ACL is one of the stabilizers of the knee, which is inside the knee joint. What happens is whenever you're playing, if you have a twisting injury in your knee, commonly it pops. You will end up in having a pop or giving way feel in the knee joint. That will end up in ACL tear. ACL tear is a very silent injury. Initially, the common presentations are minimal swelling, pain, difficulty in walking. As ACL is a forgiving injury, the patients usually neglect ACL tear. Whenever you have pain or sudden giving way in the knee, you should visit a nearest orthopedic surgeon available and get yourself diagnosed for an ACL injury if at all you have. ACL injury it's very difficult to diagnose with the help of the investigation. The best way of diagnosing ACL injury is a clinical examination by an orthopedic surgeon. First is you should get it diagnosed by getting an MRI done, which gives a picture of soft tissues. Once your diagnosis is done, you should consult your doctor. ACL injury is usually associated with collateral damage. If you are neglecting an ACL injury, what will happen is it gives strain on the other supporting structures of the knee and cushioning structures of the knee, which will end up in damaging the structures like a meniscus and the cartilage destruction over a period of time. And young people usually end up in early arthritis, which patients are supposed to get arthritis in late 50s or something like that. It is preponed to 40s, something like that. That is why never neglect an ACL tear. Visit your nearest orthopedic surgeon, get it addressed. Okay, and the best way of treating ACL is by doing a reconstruction. ACL is a ligament. We try to reconstruct it with the help of taking your own tendon from your own thigh and we put it with a suspension. There are different techniques in doing an ACL reconstruction. One of the best ways is by doing a suspension technique, which I usually follow. And as we are putting a tendon in place of a ligament, the patient needs a regular rehab and physiotherapy for a duration of 3 months. In a duration about 3 to 5 months, the patient is back to normal. For a normal activity of life, it needs about hardly 1.5 to 6 weeks of time to come back to normal life. If the patient is a high demanding activity, he might require about 3 to 6 months of time. Usually patients do very well post ACL reconstruction. Some of the associated injuries with ACL tears are the meniscal injuries also. If patient has both, it becomes more mandatory for them to get a surgical repair done. ACL usually doesn't get healed on its own, as it is inside the joint and it's free floating in the joint. Very rare events that it can heal on its own. It needs an surgical intervention and mechanical stability. Once knee attains a mechanical stability, there will be less collateral damage, and the outcomes of the ACL are very good. That's why most of the sports injuries should be addressed with a proper sports specialist. Try to contact me in Lybrate.com, or you can contact me at PACE Hospitals, Hyderabad.